This is Open to Hope Radio, featuring Dr. Gloria Horsley and her daughter, Dr. Heidi Horsley, coming to you on behalf of the Open to Hope Foundation, dedicated to those who are looking for hope after loss. Now, here's Dr. Gloria.
Welcome to the Open to Hope Show. I'm your host, Dr. Gloria Horsley, with my daughter and co-host,
Dr. Heidi Horsley.
This show's brought to you by the Open to Hope Foundation and our partner, the Compassionate Friends. We have a mission of helping people find hope after loss. Well, we have a very interesting show today, Heidi, and we are going to be talking about the topic of compassionate choice, given the fact that you may be dying. Some people call it assisted suicide, and we'll be talking to our guest about that today.
We'll also be talking to people about how people heal after a loved one has died by an assisted suicide. And our guest today is an expert in this field, and his name is Dr. Robert Leiner. He is a graduate of Stanford University, honors in Humanities, and the University of Rochester Medical School. He practiced and taught OBGYN for 20 years in San Francisco, was in private practice in the Bay Area, and served on the faculty of UCSF in their Prenatal Diagnostic Center. He is now retired and volunteers with Compassion and Choices. Welcome to the show, Robert.
Thank you. It's a pleasure to be here.
Well, Bob, talk to us about the organization you're involved with.
Sure. Well, Compassion and Choices is a national nonprofit, and we're dedicated to improving the quality of care and the choices available to people at the end of life. Part of that is to try to make sure that palliative care is delivered in a way that allows people as much in the way of options, as much choice as possible. And that means, in our view, including the option of hastening their death by with what we call physician aid in dying. We prefer to not refer to it as suicide because although we want no pejorative meaning to be attached to suicide, people who die by suicide, as you know, often feel compelled to do that and don't have much choice about it either because of their emotional illness. But it's still a little different from the situation of someone who is actively dying from cancer or heart disease or a ALS and has an inevitability about their death. These people aren't seeking to die. They would much prefer to live if they had a choice. But what they are interested in having is some control over the how of their dying.
Right. And given that, our real focus is on the people after the death, and that's not something that gets talked a lot about. But Heidi and I are wondering, what about the families after?
And how does this impact the grieving process?
Well, the best way of looking at that probably is to look at the experience of the state of Oregon, because aid in dying was made legal in Oregon back in 1997, actually a little before that, but enacted starting in 1997. So there's been 17 years of experience in the state of Oregon. And I can point to a study that was done by a psychiatrist. She's works in the Department of Psychiatry and Palliative Care at the Oregon University of Health Sciences. She did a study pretty recently that was titled "The Mental Health Outcomes of Family Members of Oregonians Who Request Physician Aid in Dying." And the lead author was this woman, Linda Ganzini. And what they found was that the pursuit of aid in dying did not have any negative effects on the surviving family members, and that, in fact, it was associated with a greater preparation and acceptance of death. So there was no influence on subsequent depression or grief, and people whose loved one availed themselves of the so-called Death with Dignity Act in Oregon, they felt that the choices of their loved ones were more honored and less likely, and they were less likely to have regrets about how the loved ones died. We're in the good memory business. We want people to have good memories about the dying process, if possible. The experience, it's sort of like it's so because somebody said it's so, but But Oregon is the state that has the most experience with this because it's been out in the open and therefore very much discussed. And that's for 17 years. Well, in 17 years in Oregon, as again the best example because there's the most experience there, there have been maybe about 800 people who have chosen to use the Death with Dignity Act in Oregon. And that's out of maybe 20,000 deaths a year in Oregon. So less than something around 0.2 to 0.5%. So it's a small number. But Gloria and Heidi, what we've heard from families that have been interviewed about this is that even though about a third of the patients who are terminally ill who get a prescription from their doctors, about a third of them never use the pills. They just keep them in their bedside drawer. But uniformly, they say that it was an enormous comfort for them to know that they had a key to the exit, to be in charge. And in fact, for some of them, they might have lived longer than they would have otherwise because they felt a relief of the anxiety. And one of the things we stress is that the best preparation for death is a life that's fully and well lived. Now there are 5 states where aid in dying is considered part of the options for good medical practice.
Right.
But in the other states, the status quo is secrecy because doctors can go ahead and give people overdoses of what's called palliative sedation. They can give them.
Now, I want to point that out, Bob. Doctors have always been helping people at the very end, and they call it what?
Well, it's called, in modern terms, it's called palliative sedation.
Right.
First of all, the good news is about 95% of suffering of pain at the end of life can be relieved with standard palliative techniques, something like 95%. And pain is way down on the list of motivations for people who use Oregon's Death with Dignity Act. It's not pain. It's more a matter of fearing losing their essential selves, having they're losing their ability to relate to their loved ones, losing a sense of themselves. In a way, it's a kind of a last self-defense act. So, but in states where it's illegal for someone to have physician aid in dying, that's where there is secrecy.
Yeah.
In fact, in Oregon, ever since the Death with Dignity Act was passed in 1997, the conversations about death and dying have improved and increased tremendously, and we've had now there are continuing education requirements for physicians to take pain management courses, so that will help to not have pain be a controlling factor.
So Bob, what's really important for the family and for everybody is conversation,
Absolutely.
right?
Just as with grief, after someone has died.
And talking about if they did decide to do aid in dying, I hope this radio show will help if anyone is feeling like a moral issue or whatever about their loved one taking their life. Have conversation. It's an interesting conversation to talk about all of the ups and downs and highs and lows. And it can be, talking about the moral conflict. Don't let yourself get isolated. Don't keep it a secret. Go on your site.
Reaching out to other people who have had loved ones die by aid in dying.
Absolutely.
Because the more we can reach out to people that are like us, the more that we feel like, it normalizes our own experience.
And also for them to know that not everybody's in agreement and to be able to talk about that and to be able to come around to that circle.
And unfortunately, I think there's a lot of judgment in the world, and people it's really easy to be a Monday morning quarterback. And unless you've been in that situation, I don't really think you know what you would do. But it's easy for people to stand back and judge, and I think people need support. They need people to come in and support them no matter how their loved one has died. And I think this could be, this could have a stigma, like you said. It could have a stigma that could be negative, and people wouldn't get the support that they really need and deserve.
Absolutely.
After a loved one.
Now, tell us the website for your site, Bob.
It's www.compassionandchoices with no punctuation, just the compassionandchoices.org. And our services are free, too. We do education, but we also do direct patient services. We offer consultation. We encourage people and tell them how they can go about doing advanced directives.
So we want to thank you for being on the show today and being willing to open up to this dialogue and thought. It's really great, Bob.
Thank you. It was a pleasure being with you.
Well, thank you all for listening to our show today, and we hope that you'll tell people about this show, and because it's a pretty amazing topic to have open. And you've been listening to the Open to Hope show, brought to you by the Open to Hope Foundation and the Compassionate Friends. Thank you so much for listening today. And Heidi and I always like to say, if you've lost hope, please lean on ours till you find your own, and God bless.
You've been listening to Open to Hope Radio, hosted by Doctors Gloria and Heidi Horsley. Like today's edition, all of our past programs are available on demand at opentohope.com, along with helpful articles, videos, resources, and links to help get you through the toughest time of your life. You can also follow us on Facebook and Twitter and sign up for our monthly newsletter. Again, that's opentohope.com. Check it out today.